Hello, everyone. My name is Marcel Vander Wier, and I am the editor of OHS Canada. I'm joined today by MJ McDonald, CEO of Construction Safety Nova Scotia in Halifax, Roger Tickner, President of Tickner Safety in Richmond Hill, Ontario, and Paula Campkin, Vice President and Chief Safety Officer at Energy Safety Canada in Calgary. The goal of this session is to gather information on each of your experiences over the past few weeks as Canada works to get through the COVID-19 pandemic. I'm happy to have 3 provinces represented, and I'm looking forward to getting a broader picture of how health and safety across Canada is being affected by COVID-19. So let's dive into the questions. Let's start with you, MJ. I'm looking for your response to how has the COVID-19 pandemic affected your team and your clientele?
So I think in a word, I would say drastically. We've transitioned our office, as many have, to be able to work at home. Trying to support our team. Working from home, many of them have young children and they have childcare challenges, or some are living alone. So even wanting to make sure that their mental health is being well addressed. We actually had 4 of our team members who were quarantined, having come back from international trips. So had a lot of issues just around supporting the team, technology issues, as you switch from trying to work from a server-based system financially and otherwise to moving out into the home. From a business perspective, we're a training and auditing organization primarily, so it affected all of our customers, all of our members. To the degree that we have suspended in-classroom training, and we are now looking at how we can retool. We've always had online training, so we've been able to continue with that. As far as our members in the construction sector, like many across Canada, with the exception of Quebec, construction was deemed an essential service, so the work continues. So from our perspective, our role was to help support them, understand what these new health and safety hazards were and how to best work through them. And so we've been busy trying to figure out what the new infection prevention and control world looks like, what this new virus is like, and how we can give the best advice and training to our membership. So it's been a huge impact.
Roger, would you like to chime in on what you've seen in Ontario?
Yeah, well, they just held a press conference. Doug Ford, the Premier of Ontario, just held a press conference, and they've closed industrial construction.
Oh, that's a big one.
I think it's midnight Saturday night. Industrial construction is going to be closed down. They also had the projections. They had a number of doctors doing projections, and there's projections of, by the end of May, 80,000 cases in the province of Ontario, with somewhere between, they're thinking 3,000 to 15,000 fatalities. And I don't know how realistic the numbers are. I personally have a different perspective on it, but we've been very busy. We started our response in late January. I personally call my staff every Friday, make sure that they're okay, make sure that we're on sites and they've got enough work, they've got the proper PPE, they have enough of it, and so I make sure that they're okay. And so they're in pretty good spirits, but the construction industry has faced some very hard times. The physical distancing is the challenge. The physical distancing and hygiene on construction sites is really the challenge. And I have probably 30 to 40 developers that have really gone the extra mile. And I have major sites where they have full-time cleaners. So somebody goes to the washroom, it's cleaned right after. So like every time somebody goes to the washroom, it's cleaned after they go to the washroom. So some are doing a great job, some are lagging behind. And just as in the city of Toronto, Mayor Tory, they closed the parks and they barricaded the parks, and people decided, well, it was a nice day out over the weekend, so let's move the barricades and go to the parks. And so now they've instituted an automatic fine of $750 to $5,000 for people that just don't want to pay attention to this very serious circumstance. So
Thanks. I'm curious to your take, Paula, as well, just in terms of what things are like on the ground in Alberta.
Yes, thank you, Marcel. And much like Roger and MJ, this has changed our business dramatically, and it's unprecedented. We've never seen anything like this. And this global pandemic comes on top of an already depressed oil and gas market. So we're seeing sort of a double impact for the activity. And much like MJ was saying, we've moved completely to remote working. A lot of our industry, oil and gas, is considered essential service, like the pipelines. You got to keep the product moving, and the construction as well. And so I know our companies have been working with their employees to figure out processes and ways of working in this new world where social distancing is required. There's been some pretty good standards that have been released for construction sites and also for remote camps. So that's been good. But I would say, yeah, overall that the entire way that we have done business is changed in the last month.
Okay. Thanks for those initial responses. Roger, you touched on this a little bit, but I'm curious if you can discuss the response measures issued by companies within Ontario in terms of safety. What would you rate them as a good response, or is there much more to be done?
I think it's yes to both, but I'm really impressed with companies have really stepped up, especially the essential services companies. They've really stepped up quickly. We've been writing policy, probably 15 hours a day. We're writing specific policy for specific circumstances. There's a lot of companies that are getting involved with screening. So for example, we have clients that are doing, every morning they do like a safety talk with all of their people every morning, record that information. And then once a week, they do a screening process to make sure that anybody, have you traveled outside? Have you traveled outside of Ontario? Have you traveled outside of the country? Has anybody in your family traveled outside? So there's a lot of very good, solid protocols that have been implemented by a lot of very good employers. For every good employer, as we well know, there's a lot that just don't care or don't pay attention. So that's the challenge. It's like citizens, right? You got a bunch of citizens that are great. You got those that want to move barricades in park and go to the park and stand beside each other or things like that. So I've been pretty impressed with a lot of the companies. I think a lot of people have been paying attention to, the press releases of or the press meetings with Justin Trudeau and Premier Ford and our Minister of Health, Christine Bentley. So I think that's probably true across the country, is that I think all the premiers and all the ministers of health, et cetera, have really stepped up and done a terrific job. Can't say enough about frontline healthcare workers, doctors, and just all the people that are essential services in emergency response. Really impressive response thus far, and I think it will make a huge difference at the end of the day when we start to see the rear end of this virus.
Thank you. MJ, would you like to weigh in on that? What you've seen out of Nova Scotia businesses in terms of the response to COVID?
So very similar here in Nova Scotia. A lot of questions around the distancing and the hand hygiene, the checklist, and whether, some are even instituting a health checklist on a daily basis, which is certainly what we have been recommending. So, do you have a temperature? Have you traveled? Have anyone you've been in contact, have they traveled, and so forth? We've gotten a lot of questions in particular around the 6-foot rule, which is the directive that we have from our Chief Medical Officer. And we have been working actually with the Department of Health to help interpret that and apply it and comply with it, because we have had questions around it may not always be possible to work within that directive. And so we have come up with some guidelines around what you may do if you cannot in any other way avoid that task and it must get done. And so issuing some guidance around that as well. But very similar to, the hand hygiene has stepped up considerably, and that social distancing for sure.
Okay, thanks. Paula, do you want to weigh in on that as well?
Yeah, I think that we're seeing some good, decisive, immediate action to address the current environment, and that includes the preventative measures that MJ was just talking about social distancing and hand washing, but also the guidelines on what to do for construction sites. We're seeing that. The other thing that we've been quite impressed with is the government we have programs like the COR, the Certificate of Recognition Audit Program, and they've been very proactive working with the safety associations from across the province to say, how can we help impacted employers through this process? So coming up with ways to give them an extension on their COR. A lot of times they need that to bid work. I know at Energy Safety Canada, we did the same thing. A lot of times that employees require our certificate to get on site, like if it's H2S awareness alive or well control courses. So we've also looked at extending the deadline for the expiry on those certificates out into September. So I think that we've been quite impressed. Companies also seem to be really pulling together and working and collaborating well in this environment. So I think, yeah, overall, I would say it's been very positive.
Awesome. I'd like to go right back to you, Paula. In terms of advice you might share for health and safety professionals across the country in dealing with this pandemic, is there anything you would offer?
Well, yeah, so a little bit of advice, but first of all, an acknowledgement that the safety professionals right now are a lot of times on the front line. They're on the crisis response team. So I know that we talk a lot about the medical professionals, but just acknowledging the role that the safety professionals are playing right now. And I think, advice, somebody mentioned it earlier, in addition to all the physical, how do we keep our people safe, the mental is so critical during this time. And we're finding that people just really, really want to connect. And so when there is whether it's a supervisor checking in with their people every day, or whether it's, we're seeing a lot of companies offering free webinars on whatever it may be, but some are on mental health. We're seeing overwhelming response to those types of things. So that's what I would say. A piece of advice is don't forget about the mental health or connection, critical during this time.
Thank you. Roger, would you like to add anything in terms of what OHS professionals should be on the lookout for?
Yeah, we've been, I'm a lot on LinkedIn, and I've been for probably 6 weeks now, just discussing positive messaging, and because it's very easy, and it links to the psychological safety aspects, and it links to mental health. It's very easy to get caught up in numbers and the negativity of numbers and the negative messaging, and media tends to want to sensationalize numbers and things of that nature. So we've been trying to just keep things positive, keep people calm, mention about the need to be have good information. Know what you're doing. We talk about physical distancing. I'm not a big fan of the term social distancing because it just has the wrong connotation. So I've been after media for at least 2 weeks, just saying it's physical distancing. And even our medical officer of health now is starting to say it's physical distancing. It's a number. It's 6 feet. Social distancing. We don't want social distancing. We want people to socially connect, because that's a huge impact of being us positive. Connect with our friends, connect with our families, and just stay in touch. It's like I said earlier, I started a procedure where I call every one of my staff members personally every Friday and just say, how you doing? How's things going? What do you have? What do you need? And it's I have people to do that, but I do it. And it's just simply to say, we care. We're interested in your well-being. I want you to be safe. I don't want you to take any chances. If you don't feel comfortable, stand down, right? If you don't feel comfortable, you don't have to be there. And so I think in the safety profession, I couldn't agree more with Paula. I mean, I actually posted a post on LinkedIn about our profession and what an amazing job, because we're often like the last people to get any credit out there. But we've done an amazing job in some very difficult times of going out and educating people and spreading the message, spreading the word, to just try and keep people away from the virus. And that definitely will have an impact on reducing the exposure and the number of cases. So I think we've done a great job. I think the Ministry of Labor in the province of Ontario and probably throughout Canada doing a terrific job with inspectors paying more attention to, employers that aren't in compliance with, the needs of what COVID presents. So I think we're doing a good job. I think positive messaging, though, goes a very long way to helping people overcome the psychological impacts of constant negativity.
MJ, would you like to add anything in terms of what advice you might want to share with OHS professionals in your province?
Very, very similar, I think, to what Roger and Paula have mentioned. We've had a very strong focus, both for our team and for all of our members and workers on the ground around mental health. And in fact, this year, from an operational plan perspective, our focus was and is on mental health in the construction sector. We know that it is not good, and it has a very high suicide rate. And we're concerned that this pandemic will, play into that. So similar to Roger and I think Paula, the support systems, we've instituted a weekly check-in with our team as well. So we have a full team virtual check-in every Friday morning. We've reiterated the EAP supports. We're leveraging our website and our social media advertising to really get some messages out to everybody, actually, so our members and the public around good mental health. So there's 6 or 8, stay balanced, get your rest, disconnect, take some me time, meditate, those kinds of things. Maintain your social connections. That's such a huge one. So we're really trying to, I think, approach it in a holistic manner. And as well set our advisors up at home so that they can answer any questions that our members have very quickly. So we've got the phone system completely transferred over to have that immediate response and support.
Excellent. With that, I'd like to thank each of you for your comments and wish you all the best as you continue to lead Canadian workers through COVID-19. Thank you so much.
Thank you all. Everyone stay safe.
Be safe, everybody.
Wash your hands.